Welcome to the Deep Dive. We cut through the noise, get you the insights you need. Today we're tackling something many of us face, helping a loved one recover from surgery. It can feel like information overload, right? But we're focusing on one really crucial, often overlooked role. That's the caregiver role, especially for an older adult. Our guide today, it's basically a caregiver's playbook put together by a top geriatric oncologist. Decades of wisdom, really, made practical.
Exactly. And that perspective is so important because this guide sees surgery not just as, a one-off event. It's more like a journey or maybe a three-act play, clear beginning, middle, end. And in this whole production, the caregiver is the director.
Right.
Seriously. Your planning, your vigilance, your patience, they're not just nice to have, they're absolutely essential for a good outcome, especially, for older folks where recovery can be a bit more delicate. So, our mission today is simple. Turn that anxiety you might be feeling into real, confident action. Make you the best partner possible for your loved one.
Okay, great. Let's unpack Act 1 then. The playbook calls the pre-surgery days your golden window for prep. It's like you're the chief operating officer for this whole thing, setting the stage way before showtime. These are proactive steps, things that can really change how the whole recovery goes. And a huge part of that early prep is getting together the go kit. Now, this isn't just like tossing random things in a bag. It's very strategic. Packing for comfort, yes, but also function. And keeping your loved one oriented in that, frankly, confusing hospital setting. Think bare necessities, upgraded, loose clothes, comfy stuff, but specifically a button-down or zip-front robe. Might seem small.
Oh, it's huge.
Yeah, why is that?
Well, think about someone post-op, they've got an IV, maybe an incision. Just getting dressed can be painful, frustrating. A front-opening robe minimizes movement, less strain, preserves dignity. It makes a massive difference in how they feel. Comfort, confidence.
Makes sense. Okay, and here's something that jumped out at me, kind of profound actually. The huge importance of sturdy, rubber-soled slippers or shoes.
Yes, non-negotiable. Hospital floors are slick, and the playbook is crystal clear. Preventing a fall for an older adult. Priority number 1, full stop.
It's more than just physical safety though, isn't it?
Absolutely. It's psychological safety. A fall, or even just being afraid of falling, that can make an older patient really hesitant to move. And lack of movement, that slows down recovery itself. So those non-slip shoes are literally the foundation for getting back on their feet, confidence-wise.
Got it. Beyond clothes, there's the sensory toolkit.
Yeah.
Hospitals are weird places, disorienting. They need their links to the real world. So, eyeglasses, hearing aids, and this is crucial, with a labeled case and extra batteries. Don't forget the batteries, dentures too.
And this is where that geriatric oncology perspective really clicks in. For older patients, cognitive function can be, fragile in the hospital. Not having glasses might just be annoying for someone younger. But for an older adult, it can actually lead straight to confusion, even delirium. It's that serious. Yeah, these aren't just conveniences. They're vital tools connecting them to reality. Without them, that strange hospital environment, it becomes terrifying, fast, and that can genuinely delay physical healing by weeks. They really are, as the playbook says, bridges to the world.
Okay, so sensory aids are critical. Then there's the me file. The guide calls it your command center in a binder. This is where you stash all the vital info, right? Med list, complete, up-to-date, dosages, frequency, everything. Vitamins, supplements too. Copies of insurance cards, ID, maybe legal docs like a living will or healthcare proxy, key phone numbers. But here's the kicker from the playbook. The single most powerful tool in this super organized file is just a notebook and pen. It sounds almost too simple. Why is that so effective?
Because hospitals are just information overload zones. You've got doctors, residents, nurses, therapists popping in and out. They're giving instructions, sometimes fast, sometimes maybe even slightly differently. That notebook, it's your external hard drive, your fact checker, your memory when you're stressed. You're not just listening, you're actively building a record. Who said what, when, what's the plan? For you and for your loved one, that consistency, that clarity, it helps prevent errors, ensures everyone's on the same page. It's your reference point. It's basically empowerment right there in a simple notebook.
Right. So go kit packed, me file ready. Now let's talk about setting up for homecoming, making it smoother. The playbook is adamant. You do not want to be scrambling to make the house safe after their discharge.
Yeah.
Stressful time. Do it beforehand, during that golden window.
Absolutely. That pre-surgery time is naturally anxious, lots of unknowns. Focusing on prep gives you, the caregiver, some control back, confidence.
So first step for home prep, clear the decks. Sounds obvious, get rid of clutter. But the playbook adds a layer here.
Yeah, it's not just about physical tripping hazards, is it?
Exactly. It's about psychological barriers too.
Yeah.
An older person recovering might fear falling so much they just stop moving.
Which is the opposite of what they need.
Right, so clearing, throw rugs, cords, clutter, creating wide paths, especially bedroom to bathroom, kitchen. It's safety, yes, but it's also about encouraging movement, boosting confidence. It's surprisingly deep. Next, set up a command center at home. A recovery space, ideally main floor, avoid stairs if possible, bed, recliner, whatever. Make sure everything's in arm's reach. Phone, lamp, remote, water, meds basket.
Just imagine them trying to reach for something when they're in pain or unsteady. Every stretch is a risk, or just extra effort they don't need. Makes perfect sense.
Then you need to stock the galley. Prep and freeze easy meals. Soups, stews, casseroles, things you can just heat up.
Yeah.
And stock the pantry protein shakes, yogurt, applesauce, broth, easy stuff.
And that point, stocking the galley, it's more than just convenience. It ties right into how the body heals. Hydration, nutrition, they're the literal fuels for healing, especially for older adults.
Right, the building blocks.
Exactly. The body needs good protein, enough calories to repair tissue, fight infection, build strength back up. Having food ready takes a huge weight off during those first tough days home. It's a strategic move to make sure they get that fuel consistently.
Makes sense. Okay, last big home prep item, bathroom boot camp.
Yeah.
The bathroom, high-risk zone. Right?
Definitely. Slippery surfaces, tight spaces, bending, reaching.
So the playbook suggests things like a raised toilet seat, a shower care bench, non-slip bath mat. It even calls temporary suction cup grab bars literal lifesavers.
They can be.
It almost sounds like you're turning the bathroom into a mini hospital room. But I get it, knowing they're safe in there. Huge relief. Does the guide talk about caregiver reactions to this?
Oh yeah. The big aha moment often comes when caregivers realize these changes aren't just about preventing falls. They're about restoring independence, dignity. Think about needing help every single time you use the toilet. That takes a toll.
Yeah, definitely.
Making the bathroom safe and usable by themselves. It's not just physical protection, it's empowering them. Big morale boost. Huge part of recovery, that feeling of self-efficacy.
Okay, so home is prepped, kit is packed, loved ones heading into the hospital. Now your role shifts, according to the playbook. Act 2, the hospital vigil.
Yeah.
You go from planner to, protector and advocate.
That's it. Because hospitals, while amazing, can be chaotic, disorienting places. Your loved one might be groggy from meds, confused, or just too wiped out to process everything or speak up for themselves.
So you become their rock.
Their anchor, yeah. Your job is vigilance. Watching, listening, asking questions, making sure their needs, their wishes are heard and met. You're their consistent voice.
Which means being their voice and ears. That notebook from the Me file.
Indispensable now.
The guide says, write down names, roles, every doctor, nurse, therapist. Write down your questions before they come in so you don't blank. Then write down the answers. Why is that detailed record so critical here?
Well, multiple reasons. First, you're creating a single, consistent story of their care. Staff change shifts, handoffs happen, details can get missed. Your notebook bridges those gaps.
Okay.
Second, it empowers you. You can track the plan, spot inconsistencies, remember key details when you're tired and stressed. You become an active partner with the medical team, not just someone sitting in the corner. That level of engagement, it really makes a difference.
Okay, moving beyond just tracking info, the playbook flags something really serious. Hospital-induced delirium. Calls it a common and serious complication for seniors. What exactly is delirium? And why are we, the caregivers, the best defense against it?
Great question. And yeah, this is where the geriatric focus is invaluable. Delirium isn't just being confused, it's an acute, sudden change. And it fluctuates. It might look like sudden agitation, paranoia, seeing things, or they might just completely withdraw, shut down. And it's way more common and dangerous for older adults after surgery, linked to longer stays, worse outcomes, even long-term cognitive issues. You're the best defense because you know them, you know their baseline, you'll spot subtle changes staff might miss, and you provide that familiar, calm presence, that anchor. Often, that's the most powerful way to prevent it, or even help reverse it.
So practical steps.
Yeah.
The guide says, reorient gently and often. Gives that example. Morning, Dad. It's Tuesday. You're at St. Mary's. Surgery went well yesterday. Simple, calm, frequent.
Exactly. Keep tethering them to reality.
And make it familiar. Bring a couple of photos, their own blanket, maybe a large print clock. And crucially, make sure their glasses are on, hearing aids are in, and working. Why is that so vital?
Because if they can't see or hear clearly, that disorientation just skyrockets. They get lost, frightened. Their brain can't process the input, so it fills the gaps with fear, confusion. Leads straight to delirium.
Got it. Okay, so we're watching for delirium. What about physically? Once the team says it's okay, often sooner than you'd think, the goal is champion early mobility.
Yeah.
The guide is really strong on this. Lying in bed after surgery is a recipe for blood clots, pneumonia, and muscle weakness. Why push movement when they feel awful?
Because moving is healing in this case, lying still. Blood pools raises the risk of DVT blood clots, nasty stuff, potentially life-threatening if a clot travels.
Okay.
It also means shallower breathing, lungs don't expand fully, hello, pneumonia risk, and muscle loss happens fast in older adults when they're inactive. So the key is gentle, consistent encouragement. Start small.
Like just sitting in a chair for meals.
Exactly. Even 10 minutes helps. Then work with the nurse or PT. Short, slow walks down the hall. Your role. Be their personal cheerleader. Celebrate small wins. Remind them why. Every step helps them heal, helps them get home.
Okay, that makes sense. Act 2 is intense vigilance.
Yeah.
Now Act 3, the homecoming.
The guide really emphasizes this transition hospital to home as the most vulnerable point. What happens now is critical.
Yeah, the structure of the hospital is gone. Now it's really on you, the caregiver, to manage things closely, prevent complications, keep recovery on track. The first 72 hours at home. Called Code Red. Super critical window. First job. Become a pain management partner.
Right. And the goal isn't zero pain. That's usually unrealistic.
It's keeping it manageable, right? Enough so they can rest, but also move. Both are vital.
Precisely. Which means staying ahead of the pain.
Don't wait till it's bad. Give meds on schedule, as prescribed, especially those first few days.
Exactly. Because once pain gets severe, it's way harder to knock back down.
Use the notebook again, right? Track doses, times, and how well it's working. Maybe use a 0 to 10 pain scale.
Perfect. Gives you concrete info to share with the doctor if the plan needs tweaking.
And with pain meds, especially opioids, you have to manage the side effects. Constipation isn't just possible. The guide says it's a guarantee, not a possibility.
And it's not trivial. Severe constipation can be agony, lead to blockages, even send someone back to the hospital, especially older adults.
So what's the advice?
Start a stool softener and push fluids from day one, proactively. Don't wait for problems. It's simple prevention for a potentially major complication. Managing side effects is just as important as watching the incision.
Speaking of which, wound care watch. You're the gatekeeper against infection. Follow discharge instructions exactly. Covered. Open to air. When can they shower?
It can feel a bit intimidating looking at an incision.
Yeah, totally. What exactly should we be looking for?
Don't be shy about looking closely. Daily check. Look for redness that's spreading away from the incision line. Puffiness. Any drainage that looks thick, yellow-green, or smells bad. Gently feel the skin around it. Is it excessively warm?
Okay.
Those are the warning signs of infection. Playbook says, first sign of any of these, call the surgeon's office right away. Early detection is key.
Got it. So that covers the Code Red phase. Then we move into the weeks ahead, the marathon. Healing takes fuel. The guide highlights 2 essentials, protein and water.
Absolutely fundamental. Protein is literally the building block for new tissue.
So encourage protein-rich foods.
Yeah.
Eggs, yogurt, cottage cheese, fish, chicken. But what if their appetite is just shot?
Super common after surgery. And that's where those protein shakes you stocked up on become really useful. Concentrated nutrition, easy to get down. Think small, frequent, nutrient-packed snacks and sips, not big, heavy meals. Every bit helps fuel that repair process.
And water.
Non-negotiable, flushes meds, prevents dehydration, keeps everything running. Aim for consistent sips all day long.
Makes sense. And physically, the mobility mission continues.
Yeah.
The mantra is, motion is lotion. Keep encouraging short, frequent walks around the house. Try to go a bit further each day.
Yes. It's not just about rebuilding muscle, though that's important. Gentle movement boosts circulation, helps healing, prevents clots, stimulates digestion, crucial after opioids, and honestly, it boosts mood, fights that feeling of helplessness, improves sleep. Each walk is therapy, physically and mentally.
Okay, so keep them moving, keep them fueled. What else? Be a symptom detective.
Yeah.
Know the red flags that mean call the doctor now or go to the ER. Can you run through those again? They're critical.
Absolutely. Okay, red flags. 1, a fever over 101 Fahrenheit, that's 38.3 Celsius, big sign of infection. 2, new or worsening pain that the prescribed meds aren't touching, could be a complication. 3, signs of a blood clot in the leg, a DVT. Look for swelling, pain, warmth, and redness, usually in one calf only. That needs immediate attention.
Okay, one calf.
And 4, signs of a lung issue, shortness of breath, trouble breathing, a new cough. Could be pneumonia or something else serious. Know these signs, react quickly.
That's a clear list. Very helpful.
And finally, a word specifically to you, the caregiver listening. This whole thing, it's a marathon for you too. It's emotionally draining, physically demanding. The playbook is really clear. You have to use your support network.
It's not weakness, right?
Not at all. It's smart strategy. It's resilience. Ask friends for meals. Ask family to sit for a few hours so you can nap or just get out. Remember that saying, you cannot pour from an empty cup. It's so true here. Your role. The guide calls it as therapeutic as any medication. Your planning, your advocacy, your care, those are the invisible stitches holding it all together. You are their champion. The work you're doing is incredibly important.
Wow, what an amazing roadmap we've covered today. Straight from that caregiver's playbook. We walked through the 3 acts: prepping before the hospital, the vigil during, and managing that crucial recovery at home. Lots of really practical, actionable steps to turn anxiety to empowerment.
Definitely. Then maybe a final thought for you to consider. As you step into this champion role, your active, informed presence, it does more than just help heal the body. It deeply impacts their emotional strength, their sense of security, their whole psychological well-being through this tough time. When you realize that, you see this isn't just a medical thing. It's a truly connected human journey of recovery for both of you. And understanding just how profound your impact is, that can give you even more strength for the journey ahead. You really are making an invaluable difference.